Hello, this is Dr. Jerry Hizon, here to talk about the documentation required for a patient with type 1 diabetes. As always, this is a disclaimer that you need to please refer to a particular doctor for the exact aspects of the documentation. This is a general course not intended to be medical treatment, and your particular situation may vary. So type 1 diabetes has multiple symptoms. The big three symptoms are constant thirst, frequent urination, and rapid weight loss. They usually have extreme hunger, inability or irritability and other mood changes, fatigue and weakness, and could have blurred vision. The vital signs are important on the physical exam. The head, eyes, ears, nose, and throat exam. We'll look at the fundoscopic exam. We'll look at neurologic exams, especially feet examinations for sensitivity. And on the testing and workup, we'll do a history, physical exam. There's a lot of lab works that will be done, and referrals if needed. The treatment starts with patient education. There may be pharmacotherapy, especially insulin, and then referrals if indicated. Lifestyle modifications, there's behavioral therapies, different medications like we talked about, insulin, monitoring very frequently, typically at the most every 3 months, but maybe more often than that, and referrals as needed. So in terms of patient education, the typical recommendation is to reduce stress at home, a healthy diet, remain active, and use a diabetic care record. The medications and therapies are completed as directed, and you follow up with your specialist as recommended. So on the documentation of a patient with type 1 diabetes, they might be a, say, 30-year-old female who presents for follow-up on diabetes that was diagnosed how long ago. And then you'll look at how long have they had the diabetes, was it sudden or was it gradual, do they have any past medical, family, social histories of diabetes, and what are their symptoms, and again, is it thirst, urination, fatigue, and is it intermittent or constant, do they have any pain, and then what makes the diabetes worse, what's their provocation, is there anything that makes it better, have they had changes in their eating, dietary changes, bowel or bladder changes, and then how about changing their cardiovascular, respiratory, or musculoskeletal? Do they have chronic medical conditions? A lot of times they have metabolic syndrome where they have heart disease as well as other blood pressure type problems. How have they been treated so far? Is it diet, supplements, surgery, weight loss programs? Have they had a previous workup in terms of physical exam, labs, specialty consultations? And then have they seen any specialists like an endocrinologist or ophthalmologist recently? Usually they need to have their eyes checked at least once a year for the retina. Do they tobacco smoke? So on their past medical, family, social history, how's their exercise program? Are they on a specific nutrition program? Are they on a carbohydrate constant or consistent program? And then how is their sleep? Have they gained or lost any weight since the last visit? As well as what are the review of systems, and you go through those step by step. So the objective, generally you describe the patient as an alert, say male or female, in what kind of distress, mild, moderate, or severe. Usually we'll look at heart, lung, abdomen. Usually we'll also look at their eyes, especially the fundoscopic exam. So RRR for the cardio is regular rate and rhythm. Do they have a murmur? How are their pulses? Do they, in the respiratory, are they bilateral clear to auscultation is CTA? Or do they have other sounds? Abdomen, do they have enlarged spleen or liver? And then do they have any sort of bruise or abnormal blood flow problems? Diabetics have a lot of arterial problems. How are their extremities, and how is their rashes? Especially they might have dark discoloration in the axilla and the groin. So the other one is to really be sure that we look at the neurologic examination of the feet, and we'll do something called a monofilament test. Usually it's out of 4. So in medical decision making, is it a simple or complicated case, and does it require straightforward or complex decision making? Your physician or provider will give you reasons and rationale for the treatment that they have picked. And on the ICD-10 codes, if you're screening for diabetes, it's a Z13.1. However, if you actually have type 1 diabetes, it's E10. If you have different kinds of diabetes, it could be E13.9. So ask your provider which diagnostic code they would like to use. On the plan, it's going to be patient education, lifestyle modifications, there's usually medications, and then follow up with their primary care medical provider, as well as they might want to see a specialist such as an endocrinologist who specializes in diabetes or ophthalmology. So be sure to get the correct affected side if they have any symptoms, especially diabetics can get ulcers to the feet, and you want to know for sure is it the left or the right. Be sure to document all previous treatments. You want to get past medical history of other endocrine disorders such as thyroid, and then have they had any abnormal labs, especially their hemoglobin A1C. Family history of endocrine disorders or diabetes. Learn the various questions to ask, such as the family history, social history, history of the present illness, or past medical history. And then please do not hesitate to ask your doctor or provider if you have questions about the documentation for the evaluation of a patient with diabetes. And in primary care, ask about quality measures such as when is their last colonoscopy, mammogram, and the like. So takeaway points in type 1 diabetes, which is usually that the pancreas isn't making insulin or is making too little. Insulin is a hormone that enables the blood sugar to enter the blood, the cells of your body, where it's used for energy. Patient education is the key. The patient is the one who will manage their condition daily, and education is going to be very important for them, and we need to be a resource for them. It is important to rule out any underlying conditions such as other endocrine disorders. And then it's important for the medical informatics specialist to learn the various questions to ask, as well as to read up on more on the recommended diet and exercise regimens that might be recommended, especially on the physical exam of the diabetic. So in summary, again, we want to thank you for your help, because while doctors save lives, you medical informatics specialists, scribes, save doctors. Thank you.